So we've all heard about burnout in dentistry and how it can be really catastrophic for your career. Now, the guest I have on today, Dr Courtney, went through a period of burnout which was caused, interestingly, by a major earthquake. So of all the different things that could affect your life, it's fascinating her story based in New Zealand, how a major earthquake rattled her life so much, excuse the pun, that it set her on a cascade of events and she experienced a burnout and she left dentistry thinking that she would never join dentistry ever again. She's now a passionate dentist. She's a fellow Protruserati, and it's great to always have Em's support and feedback on the podcast. So, Ems, thanks for being with the journey of the Protrusive Dental podcast over the last 3 years or so. You've been a big part of it. You've been an early adopter. So, thank you so much. In this episode, we discuss Ems and how she moved from UK to New Zealand to practice dentistry, and what are the cascade of events that led to burnout and how we can look out for the signs of burnout. So if you're in a difficult patch right now, Ems and I will hopefully discuss in a way that'll help you to identify the signs of burnout and how you can overcome it. And it's interesting that we talk about burnout and CPD because the other theme that we're going to explore in this episode is picking your CPD and deciding what's part of your personal development plan. And it's interesting, anytime in my career where I have felt jaded or burnt out, I've always found learning something new or going deeper and delving deeper into an area of dentistry, i.e. through doing courses or further education, has actually been the antidote for my burnout. So I find that by learning new things and keeping myself interested, that's helped me to overcome the burnout. Whereas in some people, it might be that you're doing too many courses and you're burning out. So we explore themes like that. Now, because I want to give lots of time to Em's story, I want to do my own little section. So I'm starting a brand new wing of the podcast. So we already have the group functions, we've already got the interference cast, which is like the non-clinical ones, we've got the main PDPs, and now I'm introducing the occlusal adjustments. Okay, so the occlusal adjustments, if ever I have a guest on and we're covering so many different themes and we're going kind of past that 1 hour mark, sometimes I just want to do a little mini segment to just give my thoughts, okay? Have a little rant sometimes, or have a little opportunity for me to go on different tangents and go deeper into my philosophy on a certain subject. So I hope you gain lots of value from this episode with Ems about burnout and CPD, and I'll catch you in an occlusal adjustment in a few days where I'm going to give you my own guidelines as to how to choose CPD. There's a balance between, yes, any new education, any knowledge that you gain is never wasted. It's always a good thing, but also sometimes wasting your money on doing courses which you don't get to apply. I've been guilty in the past of doing that, so I want to share that with you. So keep an eye out on this occlusal adjustment, the first one coming very soon. I just want to give a quick shout out to Dr. Zachary Smith, I believe from Texas. This awesome email that you sent, Dr. Smith, thank you so much. I really appreciate it from the bottom of my heart. It's messages like these that really keep me going. He said, Dr. Gulati, just call me Jazzman, your podcast is by far the best podcast for dentists. I've listened to you from the beginning and I've seen so many other podcasts start to flounder, but yours is truly life-changing. Oh my goodness. Thank you so much and keep it up. I will, Zachary, I will, and I really, really appreciate you and all the Protruserati who listen and send feedback and support. I really appreciate it. Thank you so much. The Protrusive Dental Pearl I'm going to share with you is very relevant to choosing your CE or CPD, and it's this. When you next are considering on enrolling on a course or signing up for a program or whatever, I have found this technique to be very useful. Think of a patient who will benefit. Just one, it has to be just minimum one patient that you think will benefit from you going on this course or gaining this piece of education. And then, can you apply that course to that patient within a reasonable time frame to be able to gain the most from the course? And if the answer is, okay, I want to go on a crown lengthening course and you don't have any crown lengthening patients ready and you just like the idea of knowing about crown lengthening, then maybe you shouldn't go on that course. Or maybe if you don't already own a laser and you don't have any cases that you think, okay, I'll be using that laser on, then don't do what I did and go to a laser course, okay? Yes, I had access to a laser, but I didn't have any patients already planned in my head that, okay, I might want to need to use laser on this patient. So really, I think that will save you a lot of heartbreak and a lot of missed opportunities, and then to be able to direct your learning towards more relevant courses for your population that you treat. So let's try and keep your education as relevant as possible. So I hope you enjoyed that Protrusive Pearl, and let's join Dr. Courtney now on this episode on burnout, something very serious, and picking and choosing your CPD. Dr. Courtney, welcome to the Protrusive Dental Podcast. I'm so happy that I've got a fellow Protruserati on the show today, all the way from sunny New Zealand. Please tell us a little bit about yourself, Ems.
Oh, thank you, Jazz. I'm just I'm stoked to be here and to be able to give back to the community because I've really enjoyed my experiences. My name's Emma Courtney. I'm a Liverpool graduate of 2000. I have been in New Zealand since 2005 after a 5-year stint in the Royal Navy. And I'm a mum of 3. I practice part-time in private practice, and the rest of my time I'm either studying, so at the moment I'm studying for a positive psychology diploma, or I'm blogging and podcasting also.
Yes, Fang Farrier.
Yes.
That's your other name. Love it. Tell us about your podcast. What inspired you? What kind of themes you discuss?
So it's a lot about probably the mental health aspect side of it, but how to deal with stresses that we come across in every day that people maybe take for granted that they're just things that they have to put up with or have always been there, and things they might not think that they could do better and come out at the end of the day better and have a higher energy clinical day, but have more energy and time for themselves when they come home too, because it can be quite a draining career if you let it. So just trying to save people from burnout, which is ultimately kind of where I started my journey with that side of things.
Well, this is exactly what I want to speak to you about, burnout, and it'd be great. It's always great to hear the different guests and their own personal stories and experiences. So I guess where I want to start, Ems, is just share your story about moving, and if it ties in with burnout, fair enough, but just moving to New Zealand, because a lot of people want to know, explore that possibility. I'm sure you get a message all the time from people in the UK, it's like, hey, how do you do this thing called moving to New Zealand as a dentist kind of thing, right? I mean, I was bombarded with that when I was in Singapore and I came back, and henceforth, I made the very first episode of the podcast, Expat Dentist in Singapore, and that's how the podcast, funnily enough, began, because I got sick and tired of being on the phone to someone every single day, answering the same old questions. So I want to ask you, what took you to New Zealand? What was it like? What's your story behind that?
So it probably started at uni. I started to get interested in New Zealand in terms of a holiday destination, not necessarily somewhere to live. My exposure to it was through TV and movies. So I'd seen a lot of things that were set there, and I'd seen those beaches and those mountains. And I mean, this is pre.
Are you talking Lord of the Rings?
This is pre-Lord of the Rings. So this was,
okay.
Yeah. So the first trip there, they were actually still filming Lord of the Rings. Okay. Pre-Lord of the Rings, it was like the piano and the TV series Hercules and Xena, and they were just, It was just all outdoors and breathtaking landscapes, and I'm an outdoors person, so I love to get, strap the boots on and the pack on the back and go off. We call it tramping here in New Zealand, but hiking. And I'd always had that in the back of my mind. And when I graduated, I'd got a friend that was doing a gap year or an OE in Australia, and they were based in Sydney. So I'd got couple of months before I had to join the Navy, so I graduated and then I didn't have to go straight into a job. I had until September or late September. So I thought, well, I'll go to Australia, I'll catch up with them, and we'll travel around Australia for, I think it was 6 weeks we've got planned. So I've got a return trip to Sydney. And then about a month before I was due to go, they turned up on my doorstep because they'd had financial problems and had to come back. So I was left with this return.
Oh, no.
So I was left with this return trip to Sydney, which isn't a bad place to be at, but suddenly having to kind of plan 6 weeks, whereas I was just going to coast along and just kind of go for the ride. And it dawned on me that the place I really wanted to go was New Zealand. So I did spend 4 weeks in Australia, and I went up the East Coast, but I kind of tripped in a side trip, or managed to squeeze in a side trip to Auckland, and then did some travelling around the North Island and just fell in love with the place. So much so I went back the following year to kind of do the North Island properly, well, as properly as you can do it in kind of 2 weeks. I suppose within the Navy, I was very privileged in that I had paid leave. I mean, that's something I've never seen since, so that's always a bonus. And then I did a MaxFax SHO job in my 4th year there, so kind of 4 years out of dental school. And it was a big year, it was a stressful year. I got my MFDS under my belt, and I managed to kind of accumulate 3 weeks leave together. And I was like, right, I'm going to go back and I'm going to see the South Island. And it kind of coincided with my commission was coming up in the Royal Navy. So you sign up for 5 years, and then there's a board for extension, and that was kind of coming up, and I think it was going to be just after Christmas. I was considering...
Sounds like remortgaging your house.
Yeah. Well, the next stint was going to be another 13 years, I think, or something like that. So yeah, it was going up for the Medium Career Commission. And then I was considering specialising, so what to do there, whether to stay with the Navy, because it might not have happened immediately, but they're very good in terms of CPD and looking after you. So I felt sure that I would specialise in something had I stayed on. And I was looking at outside. I wasn't too keen on going straight into the NHS from the experience I'd had. In the Navy was quite, again, privileged, I would say. And I looked at
and working in the Navy, just to put some context and some ideas for people who may be considering that route. How many patients would you see? Is it kind of like private practice? You get to do what you want, or was there a bit of the treadmill effect and requirements? Just give us an idea of that.
So I've never worked on the NHS, so I'm not a great one for exact comparisons. But in terms of kind of comparing it to the private dentistry I do now, timing and time for patients was reasonably similar. It's more focused on getting people dentally fit. So you're just, I suppose that's more kind of in line with NHS dentistry in terms of you're not trying to go above and beyond. You're trying to get people out of pain and functional, and so that they're not going to experience toothache at sea or whilst they're away and things like that. So we weren't kind of pushed time-wise, but we did have, I suppose our figures that we were accountable for were what percentage of our patient base were dentally fit. So with the Navy, you'd got lots of people going to sea without a dentist, and then they'd come back and they'd need sorting out. I was actually based on a submarine base for a lot of that time, which was a bit different. They had a lot more kind of base time. But yeah, just you weren't seeing as many patients as I understand you would see on the NHS a day. You had a bit more freedom of treatment, but then you were quite restricted in terms of materials you could use. There was a budget for crowns for the year, not per dentist, but if you wanted to kind of fly a crown towards the end of the financial year, you might find it was kind of like, no, not this time round. But there was no problems between, kind of root canal and exo. It wasn't, it wasn't a financial choice, and it was very good in terms of it sounds horrible to say you didn't need consent. Of course you needed consent for treatment, but they weren't paying patients. You were on a salary. You had a lot more freedom to just, as a new grad, it was excellent because you could just get that volume under your belt, get that all the basic stuff that you'd been taught without
get your 10,000 hours in.
Yeah, and without the pressure of feeling the need to suddenly accelerate to implants or crowning everything you see, or
not having to discuss money. I mean, that's something that is a strange thing when you enter private practice from dental school, right? So I imagine you didn't have to do that.
And that I guess is a double-edged sword, because it was great as a new graduate, and it took an awful lot of practice. It took a lot of pressure off practice, but when you come out as 5 years, or whether it be 16 years or 20 years a graduate, and you realise that actually you're probably more suited to the private dental world because of the experiences you've had, is that suddenly nobody's mentioned money, and it becomes I guess the later you leave learning about those conversations and how to have those difficult conversations, not just about the money side of things, but also about the consent side of things, because you didn't in the Navy have, or at my time, you didn't have patients asking for a certain treatment that maybe was borderline appropriate or not necessarily destined for long-term success, and having those really difficult conversations, because I think that's a skill in itself. That was something I felt quite dropped in the deep end when I did start, but we get there. So I came over here on a working holiday visa that came with a brochure on picking fruit. So I was still under 30, so you could come over for a year, I think it was at the time. I got my first job through the BDJ, actually.
Wow!
Just an advert in there, and I was. It was incredibly surreal as anyone that's had any experience with recruiting in New Zealand, because this has certainly been for most of the jobs I've had here. It's very casual. I'd kind of I'd been told I was getting a phone call that was going to be, you know, kind of the interview for this job, and I'd braced myself for something formal. And I was in Gibraltar at the time, so I was in the mess, and it was, you know, like 1,000,000 degrees with no aircon. And I sat there on my bed in this tiny room, and I was all set up for it, and I'd got my CV out in front of me and all prepped. And it was just like a general conversation about, so you like New Zealand, do you want a job? And that was pretty much it.
Excellent.
And then the logistics of registering with the dental council and stuff like that, I'd actually gone through a company that are still around called LANZ, which is an acronym LANZ, which is Locums Australia and New Zealand, I think is what it stands for.
Okay.
And they recruit from the UK for Australia and New Zealand. And although I didn't use them to find a job in the end, they do that too. But they walk me through the process in terms of applying for a practicing certificate and things like that, because the degree's equivocable, so you don't have to sit a practical exam. Yeah, but you do have to sit like an open book theory exam on local practices and Maori culture and Pacific culture and prescribing. Because you've worked in Australia, haven't you, Jazz? Is that right? Have you
Singapore, actually. It was Singapore.
Oh, okay. I don't know whether I think that's reasonably in line with kind of what Australia do, and I would put it down as like a mixture between American and European practices, both in prescribing and it's a bit of a blend. So it's not massively far off, but there are one or two things that are kind of same but different. Yeah, and then I came over. I managed to get I applied for residency when I got here because it was on the high priority list at the time. I'm not sure if it is now. And so I had that within 6 months, and I met my now husband within that time as well. And I was working up near Auckland, and he was moving down to Christchurch, and I wasn't particularly interested in Christchurch, actually. I was having a lovely time in Auckland, but I thought, you know what, this guy seems like the real deal. We'll give it a go, and if it doesn't work out, I'll go home. And, well, it did. So so here we are.
Amazing. And then so you moved to Christchurch?
Yeah. So that's where I am now.
Okay.
And I've been here since 2006, I think.
Well, tell us a little bit about... you mentioned about burnout and some of the big themes. So the two big themes I want to really explore with you is burnout and planning CPD. That's the kind of the main thing. And I think they can go hand in hand. For example, if you do too much CPD and you're doing too much at work and so much going on in your life and you experience burnout and you're not an effective learner, you're not an effective family member, you're not an effective friend, all these kind of things. Did you have a personal story with burnout?
Yeah, so I mean, I didn't, as many people don't. I didn't know I'd burnt out at the time, and it wasn't something that was talked about as much as it is now, thankfully. So something that people are more aware of. I just felt broken. I suppose if I had to pick a starting point, because the definition of burnout includes the fact that it's a chronic state. It kind of creeps up on you. It's not an overnight thing by any means. And for me, it probably started with the earthquakes here in Christchurch. So we had some major earthquakes in 2010, 2011, which we practiced through. But it was a huge shake-up. I mean, half the city was pretty much kind of destroyed, if not immediately, but needed rebuilding, including our practice had to be moved off its foundations and rebuilt and things like that. Anyone that's had any experience of earthquakes know that there's lots and lots of aftershocks, which makes life interesting, makes practicing life interesting. And
I can imagine. Oh my goodness.
Well, it's a bit like being at sea. You don't realise how good
so
your reactions are. So
as you're doing a cram prep and your handpiece is just like bouncing around.
Yeah, it's kind of so. I suppose you get more attuned to general movements anyway after an earthquake. So you're kind of waiting for them and anticipating aftershocks. But if you've ever worked in a city or on a main road and you have like a really huge truck go by and it rumbles the building, that's kind of like your real base level, like kind of on the Richter scale, maybe like 2.3, something 2 to 3 kind of side of it. Is it just you get a bit of a movement? And then beyond that, it ramps up. But you normally get a bit of a start to it. It doesn't tend to jolt straight in. So you realise how quickly you could kind of get instruments out of people's mouths and foots off pedals. But I think it was one of those things, I didn't think about it at the time because you just get on with it. But it's another source of chronic stress. You're running on cortisol, you're running on adrenaline, and it's not for weeks or months. It's for years. I mean, we've still got stuff being rebuilt now, and yeah, it just kind of it's hard to describe. But it was at the time. I mean, we were without a flushing toilet for 6 months. We had no water for 2 weeks. The roads were trashed. The local facilities around this side of town were, so like all the gyms and the community halls, everything that kind of had a community sense to it or part of routine was kind of gone from this side of town. Managing small children and working out what to them, managing patients and their anxiety. And as anyone that's practiced for a while will be aware, the dental chair goes back and it can be a bit of a psychiatry couch in terms of the stories you hear and the experiences of your patients and what they were going through. Our practice was on the edge of the red zone, and so we were zoned. The red zone was houses that weren't going to be rebuilt and were waiting to be paid out by insurance or various things like that. But those people would flush the toilet and the sewage would come up in the lawn. And this was like a year later. And just living in just real third world conditions in a first world kind of country. It was, it's a lot of shared trauma, I guess. And I think anybody individually, if you're talking about kind of burnout, is that we've all got this capacity to cope with stress. And as dentists, I think we take it for granted that we're actually really good at it. We have a really stressful job, but for the main part, we manage it like a boss. It's just so natural to us that it just comes off. But the problem tends to be when you have life events that increase that level of stress. So I always kind of look at it as like being stress and your coping tools as being like an arms race. One will bring the other up. So we need a certain level of stress and a certain level of challenge to bring up our coping mechanisms and skills and grow and move forward. But the problem can be is it's going like this, is if you have a life event like a divorce or a death, or suddenly your stress goes up and there's a lag, you can't just suddenly bring those resilience skills up to meet it. Mm-hmm. So those tend to be kind of the most kind of at-risk times, that if you're under a lot of stress and you have events like that, particularly if they happen in short succession, and you don't necessarily have the support you need to kind of go through them, then those are going to put you at risk of depression and burnout. But I kind of likened it, because I do a bit of speaking when I talk to dental crowds here, I would say that it's like not just having a death in the family, but suddenly everybody had that same death. So it's not you just kind of going up here, because in that way your community can support you and they can bring you up because they're not under the same stress. They've got the capacity and reserve to help kind of you out. But when the whole community is going through it, like with COVID, it's exactly the same. It's hard because you're dealing with all your patient stresses, and you're dealing with the stresses of everybody you meet. Everybody's on a short fuse and it's not necessarily having a bad day, but it's not necessarily at their best self or their most tolerant self. And it then makes it very, very difficult. And I think that's one thing that the earthquakes have taught me, is that it's a long recovery. Gosh, we want it to be a short recovery. I remember the main quakes here were February 2011, and most of like the accommodation and stuff was trashed. The sports grounds, the rugby fields were trashed, and it was the year we were hosting the World Cup, and Christchurch was going to pay host to England. And But in those first days, everyone's, we'll be back on track for the World Cup in like October or whenever it was. And I mean, that's human nature to have that hope, but it's a long game. Mm-hmm. And COVID's going to be the same. It's forever changed our landscape. It's forever changed how we are going to practice dentistry. And it's another trauma that we're going to have to be aware of, not just from our patients, but from our staff and our colleagues, in terms of everyone's dealing and managing it with it in different ways. And that stress is putting stresses on other things that we can't see, like at home, like marriages and relationships and health, all sorts of things. Sorry, I've gone on a bit of a sidetrack.
No, I'm just trying to. No, that's fantastic for your input, and devastating what you experienced in terms of the earthquakes and that impact it had on you and your community. Was clinical dentistry a source of stress for you that you think contributed to your period of burnout, or do you really think that it was mostly what you're going through with the earthquakes that was responsible for your personal story of burnout?
Combination. So, I mean, the earthquakes didn't help. I'd got 2 children under 2 at the time of the quakes. And then 2 years later, I had my daughter, who I don't look at it as a stress, but it is I suppose there are extra things that need doing in terms of she has achondroplasia, so she has a disability. So she did require more care, particularly more so when she was, kind of under 5. And working 3 days with 3 kids under 5 for a while, so at preschool, and it just puts an awful lot of strain on you, not sleeping properly as much as you'd like to think you're kind of functioning well, is that you're just pushing. I've just been pushing all the boundaries for a long time, and I suppose you only have so much energy to give. So my response to that had been to almost kind of withdraw, like dentistry was just something to get through, to afford to do the other stuff, to facilitate the things that needed doing. It took kind of a backseat in priorities. I was at a position at that stage where financially it wasn't great. There's no maternity leave as such here. No paid leave, no paid sick leave. So obviously when you've got children and you've got to take a day sick for them, that's no pay too. And all of those things start to kind of creep in and be a pressure. And part of me, I guess, just would have much preferred to have just been at home and be the mum that I wanted to be rather than being in work. But that financial side of things also cuts down what's available to you CPD wise. So I'd not neglected my CPD, but it had been just online through journals and stuff that was local and free and didn't take up too much time because I couldn't really afford the clinical time off either. And I think first, actually, I kind of broke physically, which is something people don't talk about with burnout, is that when you're that run down and you're that fragile, is that it's a whole body effect. It's not, you can't just separate mind and body. I hurt my neck taking a tooth out of all the random things to do. And I couldn't raise my arms. So I didn't want to take time off work because I didn't have time to take, I wasn't going to be paid for my time off work. And you kind of battled through it, but I'd have days where it would go into spasms and I'd just have to kind of cancel my day at 10 o'clock. I'd come in, my neck would go, I'd have to go. I went down the medical side of things and actually ended up seeing the All Blacks doctor at the time because she deals with a lot of neck injuries through rugby. And she said to me, can't you do something else? So can you not just not be clinical? And I got to the end of the orthopedic line and they were just kind of like, it was almost like, well, you have a neck incompatible with dentistry. What are you going to do? Can you sideline out of it? It's like, well, not really. And the only physical solution they had to that was, I think they wanted to inject cortisone between my vertebrae or something like that. I don't know, something along those lines. Something that didn't really appeal. But in the meantime, I'd actually become a personal trainer, and I was like, "Well, I'll find a way to fix this. Surely it's just time and rehab," and that worked out. But when you're physically having issues like that. So that was leading me to having kind of time off and unpredictable time off, which then leads to cancelling patients and messing around patients in terms of, because we know how it is, you can cancel them, but if you can get hold of them to actually stop them coming in, or all sorts of kind of funny things.
It's always sod's law that when you cancel that patient, the next time your neck would go, it would affect the same patient.
Yeah,
and it's a sod's law that it's just, yeah.
And I had one of these, and it turned into a complaint, and it was a really nasty complaint, and in the end there was nothing to answer to, as unfortunately most of the nasty complaints are, because it's more emotions than communication. But I wasn't firing on all cylinders with those, because one of the as I say, I didn't know I'd burnt out, but one of the components of burning out is that emotional exhaustion, that kind of depersonalizing and trying to distance yourself from things. And at the time when you're in it, you think, well, I'm doing enough. I'm not going to go over and above, but I'm doing enough. And you're almost in like a protective self-defense. You know, I'm only going to do this because this protects me. But patients pick up on it in the same way that they pick up on if you're feeling rushed or if you're feeling stressed. And they will take their own, or put their own story and their own meaning to that. And this lady...
Perception is reality.
Yeah. Thought it meant that I didn't care about what was going on with her. And again, this is someone that, in hindsight, I would say was another person that had also been through, at the time, 6 years worth of post-earthquake, and had her own stuff going on, and that this was the final straw for her. And I had that, and I had another... Oh gosh, the most ludicrous complaint that was a pain to deal with as well. I had we'd done a voluntary day, which actually I would never do again. This sounds really heartless. I won't do free voluntary days again, because I'd had someone come in, and I don't know how they'd found their way into the books. The criteria for the day where you could have a checkup or a simple filling or a simple extraction for no charge, nothing complex, just almost kind of like pain management, but it was also for carers and people who had just hadn't had a stretch in, which is a great cause, and 90% of the day was very rewarding. I had someone come in that didn't really know what they wanted. It was a very confusing situation, but the short story is that I found a upper six, I think it was, that had what I can only describe as like a bin lid filling that opened and closed on it. So it's like it must have had a GI with a pin somewhere that was keeping it on, but it'd been dressed for a root canal forever ago and just been left. And I found this, and I said, well, I can't do a root canal for you. If you particularly want the tooth out, I can take it out, or I can just kind of dress it so it's not going to fall apart on you in the next wee while or whenever it was. So I dressed it, and then he came back to the practice a couple of times because he was confused about something, and I explained, and I went through his notes and this and the other, and then I got a formal complaint through to say that I'd taken his tooth out without his consent, which hadn't happened. But it's one of those things, it's one of those things that, yes, everybody's got a right to complain, and we have to answer to them. But it was another stressor on this, and
yeah.
And in amongst this, I just didn't want to be there. I didn't want to be at work. I didn't want to have anything to do with dentistry. I didn't want to. I would go into a cold sweat if I saw I got a call on my phone when I wasn't at work and it was from work. I withdrew. I didn't want to go to staff functions. I didn't want to have anything else to do with dentistry outside of dentistry, and that impacted my CPD as well. I did what I had to, but I didn't want to go sit in a room of dentists, and I didn't want to hear how great everybody else's experiences were when I felt broken, when I felt that I couldn't do it and I didn't know why, that I hadn't been able to fix myself, and that things that I had found easy and had just been second nature for so many years were so difficult and so stressful. And I just
what you described
broken.
there, Ems, of the cold sweats and feeling broken and not wanting to socialise with your peers in the same way that you used to. Unfortunately, a few of my colleagues have told me these same feelings about work, and that's when I knew, okay, we need to talk, or my friend needs help, or this colleague of ours needs help. So so any dentist who could be listening to this may be going through a rough patch in life. We are humans first, dentists second. So as a human, there may be relationship issues, like you mentioned divorce as an example. For example, there could be something catastrophic going on in their lives, and then that could be feeding at them, and they could be having very similar emotions, feelings, experiences that you've described. So maybe we can learn from your experiences. How did you overcome the burnout? How did you recognize it? How did you overcome it? And so that we can inspire and give hope to any dentist who may be in need.
So recognizing it was months later. So I got to a point where I just knew that it wasn't working. I couldn't fix it from where I was. I had tried things. I tried getting interested in new procedures. I'd got my boss was very good in terms of trying to get me interested in other things and other avenues to find something that could help kind of drive me through the day.
Get a spark inside you or something, right?
Yeah, get a spark, because he could. Because I mean, I guess you think you're kind of operating on just like a level, but your colleagues can see that you're just on this downward trend, and they can see you lose interest and see things being different. I mean, I'd been at that practice 10 years, I think I'd been. With a lot of the same personnel there. And in the end, I took a break. In the end, I actually stopped and I left, and I thought I would never set foot in a surgery again. I thought I couldn't do it.
Wow.
I thought, and I didn't, and I still didn't know I was burnt out, and I still didn't. I mean, I was quite probably depressed, but I wasn't diagnosed with anything. Because, I don't know, I think it's part of that kind of perfectionism that we have, is that it's me and it's mine to fix alone, which is nonsense for anyone that's listening. There's teams around you and people that would love to help lift you back up.
Mm-hmm. Absolutely.
And during that time, I decided, right, well, I'm going to go be a personal trainer. I'm a qualified personal trainer. I'm going to coach. I did some sports and nutrition stuff. But after a couple of months, I started to miss it, and the national conference here, the NZDA conference, was featuring a psychologist who is quite humorous, and is actually, as it turns out, married to a dentist. But he was doing the main presentation on stress in dentistry. And I still had at the back of my head, I still didn't understand what had gone on, and I wanted to know. So I went along, and there was he did this amazing presentation, which was life-changing in itself. And I was sat there, and I was literally in the front row, because I was like, I'm going to absorb all of this. This is what I'm here for. And I'd already kind of started along the lines of, I want to try and help make dentistry less stressful for people. So anyway, I sat there through that. But what I hadn't realised, or I hadn't really acknowledged, was immediately following it was Dr. Fiona Muir, who was presenting the findings of the NZDA Wellness Survey and what they'd done in 2016, which wasn't published until, I think, last year or so. But what they did was they did a big cross-sectional survey that went out to most NZDA members. In fact, I actually remember being late for work because I was filling it in, because it was one of these, one of those ones where you pick it and it's like, you are 2% through this survey. You're like, oh no, I only had 5%. But anyway, I remember doing it. And she suddenly painted a picture of burnout. And as she was describing it, and she was saying what was involved, I literally kind of like, it was a real light bulb moment. I was like, that was me. I was just crying. I couldn't control it. I couldn't help myself. There I was on the front row.
At the conference. You were there at the front row just crying.
All these stoic people sat around me, and she was telling my story on stage, and I couldn't believe it. I kind of came out of that, and I was almost in shell shock for the rest of the conference. In fact, it was like a morning tea break afterwards, and I ended up on one of the stands with some of the reps that I knew, and I was just, kind of sat down and just explaining kind of what had gone on, and what I'd suddenly realised, that that it wasn't me, that this was something that happened to loads of dentists. In fact, the survey had found that over a third of New Zealand dentists that had completed it, and it was a statistically significant number, I can't remember what, but identified as burnt out or with suicidal ideation. A third off the basis of the study.
That's just terrible.
And it was like, oh my God. So I kind of went from relief to knowing that it wasn't just me to actually being quite angry that I hadn't been prepared for this. Why is nobody talking about this? Why is it, was I just not paying attention at dental school? Was, kind of what's going on? And from there, I started to kind of work back and piece together how it happened to me in terms of what had gone on, that the physical injury turning into complaints, turning into a lack of faith in my own treatment and trying to avoid more complicated treatment, leading to probably borderline supervised neglect because it was easier not to do risky treatments than to feel like I was risking a complaint, kind of judging patients on past experiences. Oh, I've seen this kind of patient, I've seen this kind of treatment before. I don't want a part of it. Being overly anxious about focusing on negative outcomes, and in that I'd seen the stress and the coping with all the things that had gone on with life for the last 10 years, that connection, and that I'd self-isolated, which is quite a common thing to do when you're depressed or down or running, is to withdraw, because you don't want to bring other people down. You don't want to be the Debbie Downer in the conversation that turns the happy, excited conversation to, you don't want to be that person, and you don't want to say it out loud. And as I say, the CPD side of things, I could see that I'm someone that I love learning. I'll take a course and I run with it. And the only thing that saved me from worse than burnout was the fact that I had started on this fitness journey. And I suddenly realized, after trying to do as little dental learning for as long as I could, that I missed learning. That it woke me up. It lit me up. It made everything else easier. Not just what I was studying. It made home easier. It made work easier. So I started off as a Zumba instructor, as you do, and then I did some certifications for my group fitness, and that all got back into physiology, and I thought, and then I did my personal training, and every time you think you've left the Krebs cycle behind, it finds you again if you enter the world of fitness. And then I did some sports and nutrition coaching, which got into kind of like the psychology side, and I found all of this just lit me up. So for a while there, I kind of rehabbed myself out of it by throwing myself into learning things that weren't dentistry, that weren't bringing up those memories and associations, and got me back in love with learning and growing and doing things. And then I started picking dental courses that did light me up.
Okay.
That I did just because I wanted to, not because it was something I felt I should know or I should do. So I would do things.
At this point, you were not doing any clinical dentistry, right?
No, so I took maybe 9 months off. But I think the other thing that I realised with the time off is that dentistry was such a huge part of of my life. It's very difficult when because it's part of your identity. I am a dentist. To suddenly put that down and completely dissociate from it. But also going into something like personal training is actually, you go into a different kind of realm of work, and you realise that you've no experience, that you've got other experiences you can draw into it. And you suddenly start to feel, actually, I had loads of experience at what I was doing. Like I wasn't, it's that you suddenly start to value the experience you had when you have something else to compare it to. And I initially went back in as a locum. I did some work on the West Coast, which is a reasonable drive away. I'm on the East Coast of New Zealand. And but it was actually it was very therapeutic in that I knew it was locum, so I knew it was short term. It sounds horrible to say that I knew that they weren't my patients, but they weren't going to be my patients for a long term. So there was a lot of pressure off. There was no, they didn't know my story.
Which eased you back into it better than going full time into where you were before, perhaps.
Yeah, but it was like, I can only liken to it kind of like PTSD. It was very hard going in there. My anxiety levels were through the roof. I would see things on the day list.
So your first day back at the clinic, you had the cold sweats again and the anxiety again?
I would say it was probably it probably took a good month to get that it was almost like exposure therapy, like kind of put yourself in there and see those things that had been your triggers before and just ride them through and realize they weren't as bad as you remembered them, that this time it could be completely different. But it probably took me, because I went from there into some local kind of part-time jobs. It probably took me the best part of a year or two to get comfortable and to come home and my husband to be like, geez, you're happy. It's like, yeah, I've actually come home from work happy, like I'd be in a good mood at the end of the working day. And I'll tell you something, one of the tools I got there actually was your podcast. And I know this might sound really silly, but I would listen to your podcast on the way to work and I would use it because I've got like a 35 minute commute and I listen to you on double speed, so it's quite nice to hear you at regular speed.
Well done for keeping up at the 2x.
Yeah, and it was kind of like you were kind of like my pep talk for work. I would have you in the car. It was like having someone sat in the car next to you talking dentistry, but not just talking dentistry, but being super enthused about it. And I would literally kind of get to work and whatever had been discussed, I'd be like, oh, I could try that out today, or I could have a go at looking at. And I started just switching that mindset. And I still listen to you on the way to work. I don't actually listen to your podcast any other time.
That means the world to me.
It just sets me up for the day, and it's really helped bring that spark back in. That spark to suddenly say, well, actually, there are bits of this that I really enjoy, and there are bits I didn't appreciate that I could find enjoyable because I hadn't looked at them for so long. So nothing kind of massive, but just small things. Oh, I'll try that with a matrix strip, or maybe I'll try that with a wedge, or maybe and just enough that I'd kind of gone from. By the time I'd gone from home, I'd kind of left that behind and gone and completely prepped myself for a day of dentistry, and would share my enthusiasm with that. And at Darfield, where I work 2 practices at the moment, where I work with my colleague Julia. Shout out to Julia. I introduced her to the podcast, and we come in and we chat about your episodes together. Which again, it's
been great to connect with Julia. She's and thank you for recommending her to the Splint course when you've both been on, and Julia's been whizzed through it, and yourself as well. So it's great to have you two so keen and enthusiastic about it as well. And it's been amazing. I think the podcast for me has helped me to connect with people like you all over the world, and it's just really special to have that connection. I think of people who have become like-minded, a little bit geeky, a little bit funny in that way, but it helps to stimulate your day, I think.
Yeah, and I think that's probably something to be said for someone that's finding it very hard to enjoy their dentistry or feel that they've lost that kind of spark, is that it's okay to borrow someone else's enthusiasm. It's okay to kind of tag on, hang on the coattails of it, because it is infectious and it will rub off. It's one of those things. I mean, it's been studied in positive psychology a lot. Is like the contagion of smiles and laughter and things like that. Is that it just helps, and it can be it can be the first step on that ladder that you need. It can be the spotlight in the darkness to just show you that first step so that you can get on and then start to make the rest of the journey your own. There's not necessarily one spot that you'll find it, but that's just the one thing you need, is just that one boost up. And
you can get that from anywhere. You can get that for anything that you enjoy or that inspires you. It could be nature, from wherever. For you found it from fitness, from reconnecting with learning. Just being a learner for you was a big driver for you to get you back to your best you.
Yes, exactly.
But if I was to suggest that, perhaps in hindsight, do you wish, and perhaps the advice that maybe we're giving to anyone who's going through a really tough patch, is to seek help from somewhere. Obviously,
Definitely.
You didn't identify it until you were crying at a conference, and that was such an epiphany for you. I feel as though perhaps you endured so much into that journey, and if only you had that lecture sooner or whatever, or you had that connection sooner. So perhaps people need to, and you said now it's so much more widely available as well, the mental health side of things and the burnout. So, you should seek out help.
And I think help outside of dentistry, and it doesn't have to be kind of formalised help. Sometimes it can just be opinions, because a lot of the stuff that we kind of put up with and we think, well, that's just got to be the way it's got to be. It sounds horrible to say if you talk to a normal person. If you talk to someone outside of our world, they would just be like, that's ridiculous. What are you... You can't carry on like, they'll help just put it into perspective. For me... the people I work with, they have an occupational counselling program, which, again, I actually didn't find out about until after I'd been through this, which is a fault in itself, but I kind of sing the number from the highest rooftop, as it were, now. But just, I think that the stigma around mental health, around not coping, and about not being able to do it all on your own, because you should be able to. That's the voice, not what, is that message is so strong and so ingrained in us that there's a real fear. And I can remember I knew that I needed some help, and I knew that I needed some psychological help. I thought, well, I need a counsellor, this, that, and the other. And I didn't even know how to start, where to look, who to talk to, just to begin that conversation. And that was very difficult, and it shouldn't be that difficult. It should be. I would love to see on the. I'm sure you have the kind of same thing. I can't remember about the recertification with the GDC, but here with the Dental Council in New Zealand, you have on your recertification thing. You have, no, I've not been convicted of this, and no, I don't have. I don't have substance abuse problems, and thankfully now they've put, yes, I've had an eyesight check, because that's a different matter entirely. But but on there it should be, have you checked in with a mental health professional this year? Because it should be ordinary or routine, or
very true.
It shouldn't be something that you've got to be in dire need of before you seek it out. Going back to this psychologist that had presented, he started off and he said, I've something to confess. He said, I haven't had a dental checkup for 8 years. And you can hear this intake of breath from the crowd. He says, and worse still, he says, my wife's a dentist. But he turned this round to say, now, why do you think that your mental health is going to be okay without somebody checking in on it? How is it any different to that dental checkup? That's
a powerful way to send a message, dentist, right there.
Yeah. How if you had a patient with an infection, an acute infection that, and this will go into a grey zone because it's antibiotics, but that required antibiotics, you'd want them to take the antibiotics to get over so you could get on with your treatment, to get past that acute phase. But we have such a stigma around taking antidepressants and being diagnosed with depression. When actually, when we go back to that discrepancy between the high stress and that time lag between your resiliency skills coming up, if you need antidepressants here, what they're going to give you is that time to build the other resiliency skills so that you can meet the stress that you've got and match it. And the stigma around that is huge. And I would even go back to the definition of burnout, and the World Health Organization only got around to acknowledging it or defining it in 2019, which I find quite shocking, but there you go.
Wow.
So they have it down as an occupational phenomenon, not a medical condition, a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. But to me, that's stigma again, has not been successfily managed. You have it because you haven't been able to sort yourself
Painting a picture
out.
of failure, right?
Yeah, it's I don't know. I mean, maybe it's because of where I come, my experiences where I come from, but that just feels like a big finger back at you, like the cause of this lies at your doorstep. And I don't know.
Well, I hope what you've inspired
that.
for anyone, exactly. And what I'm hoping is that anyone who's in a tricky situation, that this conversation with Ems and I today, it would have inspired you to seek help. Because at any one point there will be humans, not just dentists, humans who are in a low point. Some will be a high point. But if you're in that low point and it's affecting your dentistry, affecting the care that you can give to your patients, then take lessons. And it's really lovely to hear you so openly share your story, Ems. That takes courage, so thank you, and how you overcame that. That's really, really great to hear, and so good that you have your mojo back in dentistry, and you're able to practice with full enthusiasm again. One other theme that I want to explore now is CPD, and we were discussing before we started to hit the record button about you were going to go to tell me about the different cycles of CPD, because the initial question I was going to ask you is any advice for young dentists about planning their CPD, because I get messages by young dentists all the time saying, I don't know what next course to do, or how many, should I do this course, should I do that course, kind of thing. And I think you have a really profound answer on how to think differently about your CPD. So just give about a flavour about how to plan your CPD as a dentist.
So yeah, we were chatting about kind of the new graduates, and I was explaining that in my viewpoint, kind of, you have such a massive experience at dental school, obviously culminating in finals, that you are, all your time is learning things and getting your head around it. And there's probably, you look over those 5 years, there's been a heavy slant towards theory learning and book learning than there has been towards the practical side of it. So in terms of kind of phases of advice that I would give for dentists is that first kind of 2-3 years is that I guess you kind of consider yourself, you are up to date because you've just finished finals, you've got your BDS or whatever your qualification is, and you actually need to kind of take pause to reflect on that, absorb it and practice it, because you'll have far more in terms of kind of knowledge than you'll have experience at that stage. And just really get the volume under your belt to put all of these things you've learnt into practice, to see what you enjoy, what works for you, what you do find anxiety inducing or doesn't feel quite the same as it did at dental school. And I'm not saying neglect your CPD, because we've got requirements that we need for recertification, but really just getting it done is enough. So the easiest way to get through it, and that might be through a journal and online things. It might be subscribing to something that has all your content for the year just looked after it, so that it's just one less stress and one less thing to worry about. And then as you come out of that, you should start to get a better picture of what it is you want to do or what it is you want to improve upon. And it's not, I think there's an overemphasis, and it comes from dental school, because it's about any education system really, is that education systems are about promoting further up the education system, So so dental school, the specialists are held in regard and the consultants are held in regard, and that's the career pathway that you're kind of shown. Or is the
exposure that you gain,
it's all the exposure you gain, and it's all that you really get to kind of talk and know about. And I think
which is why I wanted to be a restorative specialist. I wanted to go be a consultant in restorative when I qualified, and that was dead set that I was going to do that.
Yeah, and I've wrestled with the thoughts about specialising my whole career. Even recently, I was like, well, should I? I've still got time in my career. I could still make use of this, and I think there's no shame in saying that you want to be a specialist generalist. You know, that you want to be the jack of all trades, and you want to be the person...
The hardest of all specialities.
Yeah, that you want to be the person that could be in a rural practice and deal with 90% of the things that are thrown at them, and still acknowledge when you need to kind of refer on. But to me, you know, that's a superhero dentist right there. So, but it's not held on a pedestal. It's not, you know, it's not glorified. It's not seen. It's not even really kind of illustrated as a career pathway. It's because it's not acknowledged, and there's no title with it, and there's no formal qualification that goes with it, and all the things that we love, our certificates and our, you know, letters and all those kind of things. So yeah, don't be too pressured to go into specialism. Not to say that we need specialists and there are people there that are massively suited to it. But maybe don't make that decision 1-2 years out. Maybe give yourself a couple of years just to feel it out. Because the other thing, and Jazz, you'll know the same, is that the best specialists that you refer to and have a relationship with are the ones that have had a decent general dentistry background before, because they can appreciate beyond their scope, and they're not locked into their tunnel vision of their specialty.
Tunnel vision is the best way to describe it. Absolutely, they're the biggest trap.
Yeah, so that's probably the first stage is concentrate on getting hours under your belt at the coalface. Is, you know, get some work done, get some fillings in, get what works for you, but use that time to seek out mentors. And I think people get a bit put off by the term mentor in terms of that it might have to be some kind of formal agreement. It doesn't. It just means learn from the experiences of those around you. And even the worst mentor will have so much to teach you, because it might be teaching you what not to do and what you don't want to do down the track. You know,
I never thought about that. Well said.
But those are valid lessons too. And I think people get hung up on being in, it sounds horrible to say bad practices or under bad bosses, because I don't like that kind of black and white, good and bad. It just might be something that doesn't suit you and doesn't suit your values. But man, if you do some time under that, you'll still learn. They'll still have things. They've got to the position they're in because they've managed to do something right. It might not be something you agree with. And yeah, it's just everybody around you as a mentor. Your senior nurse, your hygienist particularly, and your therapist. If you've got anybody, it's horrible to say, anybody that's senior to you has got experience in this setting that you don't have and that you can learn from. So look for mentors. Don't worry so much about your CPD. And then the next phase is starting to think about those things, about what's your place in dentistry. And you're young enough that you can explore things and backtrack. You know, I did my MaxFax year and my MFDS, and I was going to specialise. It's not that I backtracked, but I was like, well, actually, I don't feel the need to see this through. I can do something different. But as we were talking, I think the danger zone, and this was highlighted actually in the results of this study. I can't remember exactly, but the peak kind of risk for burnout and things was about that kind of 10 to 20 year point. And the good news for those of you who are in it is it gets better after that. Whether that's just with experience and in terms of kind of life experience and dental experience and just chilling out because you're on the other side, you know, the more twilight side of your career, I guess. I don't know, but apparently the results of the survey say that it does get better after that. But that's the time when you probably need the most support, the most help with your motivation, you need to seek that inspiration from somewhere else, because that's when it's going to be struggling. You're likely to be struggling, because it was also the time that people are having families, getting married.
Yes.
People who have got married and it hasn't been the greatest, are having those painful early divorces. You're buying houses, all of these commitments that suddenly go up, and all of a sudden it's not that dentistry got any more stressful, it's just that life around it got more stressful. And that can make it harder to be enthused about work, because all of a sudden you've got other things that are starting to compete priority-wise. And it's not that you should view them as competing, but it's that you shouldn't necessarily neglect your working life as well, because it is a large time percentage of what you do. And you're at that stage where you've got, 10 years experience under your belt, and you run the risk of, day in, day out syndrome. Oh, I've just got to get through this, and it's just another filling, or it's just another crown.
Also risking, or being on autopilot and losing the love of the minutiae of the detail and the care, and that fire in your belly. You lose it. You can lose it. And I remember my trainer in DF1 telling me that at 10-year point is roughly when a lot of dentists may get some complaints because of the complacency. Right?
Yeah. They've
done extraction so many times before, and they take, don't check the medical history or little mistakes because you're just running on autopilot. When you're running on autopilot, then it can not lend itself to the best kind of care that you can give customized to our patients. So, I think you're so right. In that phase, you can fall into these traps.
Yeah, and there's something that springs to mind is what you're just describing there is mindlessness. So in terms of kind of you just operating on autopilot, you're going off rules that you've been given ages ago, and your present actions are dictated by past events. And
is dragging, and it's the complete opposite of the flow theory. The flow theory is that you're completely engrossed in something, and time. You look at the time, where have 3 hours gone, kind of thing. Whereas, when things are dragging, it's not a nice place to be.
Yeah, and it kind of ties in with Ellen Langer's definition of mindfulness, which is different to the kind of the main one we think about being present and things like that. And her definition of mindfulness comes down to kind of noticing what's new and different, and being open to differences and exploring things and challenges, so that you're not operating on that mindlessness kind of front. Is that you are treating everything as what is new and different here. What can I change or change up? And likewise, what you say about the flow, it's the way that the flow works is it's that kind of graph of challenge versus skill level. And if you're not upping your skill level, then the challenge is going to drop. And you're going to drop into the corners of that graph that once you're outside of flow and you get kind of arousal control, you end up in anxiety or relaxation or boredom, or the bottom end. So the opposite end to flow on this chart is apathy. And that's when you're at risk of burnout, because it ties in completely with that. So, I mean, the way I plan my CPD now, because I'm 21 years graduated, is that I still take care of the basics in terms of I've still got my box check, and the same that I would say for my new grads, just so that I don't have to think about meeting the requirements. But beyond that, I look for stuff that lights me up, stuff that I can see is going to have something immediately actionable that I can take away from it. And I think we have to kind of broaden our views of what CPD is, because, I mean, well, there weren't podcasts when I came out of dental school, but your podcasts, your blogs, these are your mentors from around the world that are available to you, that you don't need a formal relationship with, that you can learn from.
Very true.
Also that kind of padding out of, and I guess this comes to be, yes, if you're going to stay in general practice, is be that specialist generalist, is start to learn about business and marketing. Even if you're not running your own practice, start to have an appreciation of it. Start to seek out communication courses. Start to look into, and something I would never think is kind of like coaching qualifications have helped me, because they've helped me communicate with my patients better. They've helped me work out what it is they really want, because what they're saying isn't necessarily what they want. And we're kind of stuck in a profession that's still, the profession sometimes feels still stuck in like the 19th century, no doctor says you do kind of thing. And it's with consent and everything else, it's not that straightforward. And probably, as you were saying you were talking to Sean, he would probably have talked about it as well, in terms of you've got to know what the patient actually wants. You can't run with the first thought of got this, they want that, because then you're both of you are happy until the end of the treatment, when you realise that you've satisfied your treatment outcome, but not their needs. And
Yep.
And that's where you're going to come up with complaints. That's where you're going to have less kind of things. So, even just, it sounds quite basic or dismissive. It's communication skills are huge. If you want to avoid complaints and have more satisfied patients, and that would be a starting point for anyone. So I make sure I've got my hours tied away somewhere else, but the rest of it is actually personal growth, not just professional growth, and things that can kind of tie into that. Because, as I said, some of these you might think, well, that's not overly relevant, but you go on these courses and sometimes they can surprise you. I can remember I went on a health and safety course, which sounds, like most people would rather put nails in their eyeballs, but it was...
Yes, I'm in that category.
Well, we had a change to our health and safety laws recently, and we went along, and it was quite amusing because we went in, and I think 90% of the dentists in there were hoping for basically just a checklist of how to comply with the new laws. Now, the guy that presented the course, he was someone that dealt with workplace accidents, and particularly workplace deaths, actually. And he had a lot of stories about not dentistry, but a lot of stories about other workplace instances, and talking about, as we were talking about on the autopilot, that your highest risk is your 40 to 50-year-olds that have been doing it for so long that they can do it in their sleep. So the electrician that puts two wires together that an apprentice would never have gone near, but they've been in that mindlessness state, and it's been fatal. And it was the most surprising course I've been on, because it was nothing that I expected. It turned out to be about aging and resilience and mindfulness is what it turned out to be. And so go explore these things. And I mean, it's always going to be dictated by what time you want to spend, what money you want to spend, where you want to go for it. I always have my eye on something sometimes, and it's not always the monetary value beside it. Is that sometimes I will spend more than I want to spend on a course, because it's either something I can't get through any other means or medium, or it's a presenter that I wouldn't be exposed to normally. And I guess once you've done enough courses, you start to get that filter of, well, yeah, I can see there's going to be value in that, or I can't. And yes, sometimes you get caught out, but do try and challenge yourself.
And I've said on multiple times on the podcast for every clinical course you do one non-clinical. And I think even you mentioned coaching. That's an example, right? That's something that's made you a better communicator with your patients. That's an example of one, because there's only so many non-clinical. But anything that can improve you and your mindset and your demeanor and the way you speak, your body language, these are all important things for you as a communicator. Because as I was discussing with Sean today, dentistry is so little or what you do with your hands, and so much more what the patients feel and the communication aspect of it. So I think you'll enjoy that episode. And just like I hope everyone's enjoyed our episode today, CPD at the end, but really kind of you to share your story and make yourself vulnerable. I really appreciate that. But I do feel, whilst it might serve many of the Protruserati, just generally they might be listening and thinking, okay, this is interesting. But a small minority, I think this episode will really, really allow them to give themselves permission to seek help. And these small numbers will be helped massively. And I'm always up for helping small number of people in a big way. So, Ems, thank you so much for giving up your time today on Father's Day in New Zealand. And I know you said you got your husband a nice big box of meat.
Yes, he is a carnivore at heart. So, it's steak dinner today.
Amazing. Well, if you got any closing comments, please tell us about your podcast. Where can we listen? What's the full name of it?
Oh, yeah. I have done courses on marketing and self-promotion. This is how good I am at them, because I'd forgotten to mention it the whole time. It's Fang Farrier, which is if you're unaware, is a slang term for a dentist. That's the name of the podcast. It's the name of my Facebook group. And my Facebook page, I think, is It's a Dentist Life, which is only different because there's only so many times you can change the name of a dental Facebook page. So I can't change it to Claim Verifiable. But yeah,
I'll be sure to put the links on the show notes so people can come and listen to you more. You've got these different angles to share with the whole positive mental attitude, and your history in fitness is, it's very different genres that you explore. Non-clinical stuff, which is so important.
Excellent. Well, thank you so much for having me. It's been an absolute pleasure. I'd say I've taken a lot from this community and from your podcast and your Splint course, which I've thoroughly enjoyed and highly recommend. And it's just great to give back.
Well, no, it's so nice to be speaking to a fellow Protruserati from across the globe at different time zones. It's just amazing. So thank you so much, and have a lovely Father's Day with your family.
And you have a lovely evening.
Well, there we have it, guys. Burnout, and how to identify it and how to overcome it and how to plan and navigate through the world of CPD. Hope you gained a lot of insight from that, particularly if you're early on in your journey and you're thinking about, okay, what's my path of learning over the next few decades? Very soon, I'm going to post up an occlusal adjustment, so do check it out. And of course, if you're not part of the Protrusive Dental community on Facebook, what are you waiting for? Go on Facebook, search Protrusive Dental Community, and join over 1,700 dentists who are the Protruserati, just like you, who listen and love the podcast. And I love that, and I really appreciate that so much.